Welcome back, I am Dr. Lee of Practical Pain Management. It is one of the videos that show how much rotation and tilting I need to find a target and approach the needle. Please check the cranial tilting and rotation in each procedure. In this case, using the contralateral oblique image guidance, you will learn how to make a transforaminal injection with adjuvant parasagittal epidural steroid injection. Let's begin. It is an AP view and turns to a right ipsilateral oblique image. The compass shows 3rd degrees of rotation. Oh, he is turning more. The C-arm inclined cranially about 5 degrees. I don't have much choice in the needle entry point because of the high iliac crest and downward deformity of the transverse process. I will just put the needle in the center of the triangle and advance toward the center. If I direct the needle to the pedicle too close at the 6 o'clock position, I may hit the bones. Let me show you an AP view. I will advance the needle parallel to the inferior border of the transverse process until it reaches the lateral edge of the pedicle. Please give me a contralateral oblique view. The compass shows 40 degrees of rotation, and the needle is already in the lateral edge of the 6 o'clock position. I will connect the mini volume tube to the spinal needle and contrast the media-filled syringe, and then slowly pressurize the syringe. The contrast begins to disperse to the epidural and foraminal space. The AP. Thank you for being so cooperative. Thank you for watching, and see you in the following videos.